This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. To investigate whether you have endometriosis or not, we generally start with a good ultrasound. Now, when I say a good ultrasound, I mean an ultrasound done in a women's ultrasound clinic by experienced sonographers who are able to assess the thickness of the walls around the vagina, the mobility of the ovaries when a transvaginal scan probe is pushed against them, and also to assess for these cysts on the ovaries, the endometriotic cysts. So these are vital signs of potential endometriosis. So that's where we start. Then there are blood tests, one called CA125, which is elevated in endometriosis, albeit it's elevated in other conditions as well. So it's not totally diagnostic. The gold standard for the diagnosis of endometriosis is seeing it. So how do we see endometriosis? Well, it involves having the laparoscopy, the keyhole surgery, where we put a telescope through the belly button and can look around in the pelvis and actually see the endometriosis. If we find endometriosis when we do the laparoscopy, we can remove as much as we can see, either by cutting it out or by burning it off. This can be quite extensive surgery if the endometriosis is severe. We talk about various stages of endometriosis. Stage 1 is just where there are a few spots. That's easily dealt with. Stage 2, Stage 3, Stage 4, where the endometriosis is so severe that it's actually attaching bowel and to the uterus, closing off the fallopian tubes. And in stage 4 disease, if you've got that, you need to be operated on by a highly competent laparoscopic surgeon. There's not many of them around. Not all gynecologists are good enough to be doing the extensive surgery that is required in severe endometriosis. So diagnosis, number 1, gold standard, is to have the laparoscopy, at which time treatment can be undertaken, and symptom relief will often occur because of it. In terms of improving fertility, this also can happen, albeit the most important thing about it is that if you are having IVF, because you've got damaged tubes and because the eggs and the sperm can't get together, removing the endometriosis, if you've got it, increases your chances of a pregnancy when we put back an embryo into the uterus. So dealing with endometriosis is important in success rates for IVF. Medical treatment for endometriosis is a topic that we've struggled with for years. Using the simple contraceptive pill continuously can help the symptoms because you don't get a period if you don't take the sugar tablets. That's helpful. Going beyond that, there have been various other medications, and there are a couple now on the market that have been approved by the government in Australia to improve endometriosis. Visan is one of the names of those compounds. And that's worth trying if you're trying to deal with the symptoms. They're not much help in dealing with infertility. The other time that endometriosis gets better is in the menopause. So if we induce what we call a pseudomenopause by giving injections that switch off the pituitary gland that make the ovaries go quiet and don't produce estrogen, like happens in the menopause, we can get improvement both in the symptoms of menopause, but also in symptoms of endometriosis, but also improve the outcome in terms of reducing the endometriosis. However, it does mean going, in most women, taking it for 3 to 6 to 12 months and actually pushing hormonally into a menopause-like state. So there are side effects that go along with that. So endometriosis, a common problem, probably, as I say, in infertile patients, probably affecting 20 to 30% of women with infertility. Most come with symptoms as well as the infertility, but there is a group in which there is no symptoms. So particularly when we have done IVF a couple of times and haven't got you pregnant, laparoscopy can be helpful because we may find endometriosis that we didn't suspect. So endometriosis, as I say, common. There are approaches to it, and increasingly women are coming forward, and the medical profession is much more aware of it than we used to be.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.